Take a journey with me, back into time, back to September 2019. It's the start of a new school year, and everyone is excited to be back in the classroom. Children are sitting side by side, engaged in independent learning activities. There is no social distancing, there is no PPE, only engaged students. Fast forward to September 2020, in the midst of the COVID pandemic. The only thing that looks familiar about this scene is a child sitting in front of a laptop. There are indeed many things that look different in the school classroom this year, one of which is the lost opportunity to move. Kids love to move, ask any teacher. Whether it's low intensity, high intensity, or circuit training activities, children enjoy physical activity breaks in the classroom. More importantly, physical activity is one of the most effective ways to prepare the brain for learning. And it also helps to promote mental and physical health, prevent disease, and most importantly, in the midst of the current pandemic, bolster a strong immune system. Schools have traditionally offered many opportunities for children to be physically active with physical education, recess, before and after school sports programs, and more recently, the classroom. Yes, even the classroom can offer physical activity opportunities for children and their teachers, where they can accumulate up to 20 minutes of health-enhancing physical activity. Interrupting prolonged sitting with activity, or InPACT, a University of Michigan program, does just that. But in today's schools, many of these opportunities for children and adolescents to be physically active have been eliminated or difficult to access. Efforts to flatten the curve of COVID-19 diagnosis have resulted in the temporary closure of exercise facilities and gyms, suspension of sports activities, and recommendations that individuals and families avoid playgrounds, parks, and recreational centers. For disadvantaged youth, school closures eliminated opportunities to engage in structured exercise, as many of our youth lack safe spaces to exercise or play sports in their neighborhoods. And for children with disabilities, school closures eliminated access to inclusive physical activity, which negatively impacted their social, physical, emotional, and cognitive development. Recent research predicts that if school closures continue to the end of 2020 because of continued COVID-19 transmission, the childhood obesity rate could increase by 2%. Now more than ever, we need innovative strategies to promote youth physical activity. But how can we adapt classroom-based strategies that foster movement and activity, which are critical for children's health, achievement, and social-emotional development? Yes, how can we continue to promote social-emotional learning skills through physical activity in the current classroom? How can teachers create interactive learning experiences that promote teamwork, social connectedness, and physical activity, using virtual, hybrid, or in-person learning experiences? And how can children continue to reap the multiple benefits of physical activity to help them cope with the continued stressors of the COVID-19 pandemic? The University of Michigan, along with other statewide organizations, has teamed up to answer this question. And together, we are disseminating Interrupting Prolonged Sitting with Activity for the Home. InPACT at Home is an evidence-informed, home-based physical activity program that enables K-12 students and their families to engage in health-enhancing physical activity. Children have access to 20 minutes of cardio workout videos that are developmentally appropriate and approved by pediatric exercise physiologists and physical education teachers. Because over 90% of Michigan households have access to a smartphone or computer, we have the opportunity to reach the most vulnerable children all across the state. This family engagement initiative aims to build collaborative relationships between families and educators to support learning, development, and the health of every student in Michigan. While children are the group with the lowest diagnosis rate for COVID-19, and they appear less vulnerable to this disease, they are more susceptible to the unintended consequences of social distancing and school closures. Limited interactions with their peers and lack of social support services to help children cope with the pandemic have both contributed to increased stress and anxiety in this age group. Addressing these unintended consequences is critical to protect and improve the health and well-being of children during the pandemic. My name is Rebecca Hasson, and I am the director of the Active Schools and Communities Core Unit of the University of Michigan Exercise and Sports Science Initiative. Here at ESSE, we are proud to be partnering with statewide organizations to help K-12 students move more at home. Physical activity is indeed essential to growth and development, and by providing more opportunities at home for students to be active, we can provide equitable access to all students across the state at a time when they need it the most. I would like to personally invite you to a discussion with InPACT program partners on September 24th at 3 p.m. Eastern Standard Time to discuss how we can continue to promote physical activity to improve the health and well-being of children and their families across the state of Michigan. Thank you, and I hope to see you there.